Unipol is the leader in non-life in the Italian market and among the top 10 in Europe. At our previous event in Barcelona, Giacomo Lovati, the Chief Beyond Insurance Officer, shared how they are turning the data from more than 4.2 million in telematics insurance customers into a range of services, a mobility ecosystem that goes way beyond the traditional insurance business. And they go all in, with a significant bottom line impact as a result. But Unipol doesn't stop there. They are applying the same vision and strategy in other verticals as well. For example, in health. We're honored to have Giacomo Centini on our stage. Giacomo is leading Unipol's efforts in building an ecosystem of welfare solutions and services. Please welcome Giacomo Centini.
Morning, everyone. Thanks for taking the time and waking up early this morning to join us for the first session of this morning. I'm going to discuss with you today the strategy that Unipol has implemented in tackling the healthcare and the health insurance market, as well the welfare sector in Italy. So, first of all, let's start with a little bit of context. What Italy is facing now is a strong challenge in the healthcare sector in general, especially due to the inability of the public sector to cope with the current healthcare needs. This is due to different factors. I guess they are not so different from other countries in Europe and in the rest of the world, but the public spending is lower in Italy than in other countries, and this has been due to several reasons, lower wages for health professionals and things like that, but now this thing is kind of get to an edge where it's not sustainable anymore. Another thing that has been going on in the recent years is that the overall healthcare sector has been under pressure due to the turnover of physicians and sanitary personnel. So we're reducing the number of physicians able to cope with this challenge. And this as well is stretching the limit of the public health system. The COVID then kicked in and basically increased the stress of the system with a lot of people that delayed care and the inability of the health system to cope with non-urgent, non-emergency needs for a couple of years. So now we're facing this backlog that has been building up over time, and the healthcare system in Italy is under stress for this. The last thing is that Italy in general has been a little bit delayed in introducing digitalization and is now forced to introduce measures of interacting in a more digital way, and this is especially true for the public system. And this is now something that is impacting in a very stressful period, and this change, which is still undergoing, is also increasing the complexity in the health system to manage the offering that is expected from our citizens. So what we're seeing is long waiting times, long waiting lists, and people are trying to seek alternatives in order to find a response to their health need. This is driving an increase in expenditure overall, and as we can see, the increase in expenditure is higher in terms of growth on the out-of-pocket expenditure, which is something kind of new in a country like Italy, where all the people has always approached the national health system as the standard answer to their needs. Now it's not true anymore because of these long waiting times, and more and more people are seeking alternatives, especially for non-critical, non-life-saving type of needs, but needs that need to be addressed anyway. So like the usual health problems that all of us might face time to time that needs the attention of a specialist. And sometimes in order to access this, you might wait a few months in the public health system. So people are looking for other responses and mostly are going to the private sector. What we have seen as well as an insurance, we have seen a relevant increase in frequency. We used to have lower frequencies before COVID because many people, insured people with us that are insured through their employer basically didn't use much their coverage. They went by default to the national health system in order to address their needs. Now this is shifting. So a lot of people are trying to leverage all the possibility, all the chances that they have in order to access care. And this has driven not only the increase in out-of-pocket, but also the increase in usage of the insurance and an increased attention in health insurance in general. So how is Unipol approaching to this challenge, to this opportunity? Because we are facing both sides of the medal. We are seeing like this as an opportunity to kick in and help the country in order to solve a problem in terms of how to respond to the health needs of our citizens. And at the same time, we see it as a challenge in terms of increased need of health support for our insured customers. And we need to find ways to serve them better in a moment where they cannot find answers somewhere else. I'm going to talk to you today about specifically how we address the strategy within the welfare ecosystem, which is the ecosystem that I'm responsible for, and how we have been structuring this strategy in the last 3 years. So first of all, just a little bit of context of what is Unipol, so who we are. We are the #1 insurance company in Italy. We have around 50 billions of premiums collected every year, and we are able to return to our shareholders something less than 10% in net income. We are leading the motor insurance and the health insurance with around 1/4 of the overall market, and we are serving with different type of services and insurances around 70 million of Italians, which is something less than 1/3. So it's quite a relevant number of people that interact with Unipol for different services every day. How we've been able to do this? Several reasons. The most relevant probably is the largest distribution network that we have in Italy, and it's based on over 2,000 agencies that can count on 20,000 agents and sub-agents. Plus, we have developed in the last few years a strategy through bank insurance by investing in BPER and Banca Popolare Sondrio. BPER is the 3rd largest banking group in Italy, and the Banca Popolare Sondrio is a very relevant bank in the northern part of Italy. And we own around 20% of their capital, so we are able to control them and manage the partnership with them in a very strong way, allowing us to leverage their network of around 3,000 branches, bank branches around Italy. So this is a very strong point that we have been leveraging in the different strategies that we have implemented. So what's about the beyond insurance that was being mentioned in the introduction video? What's all this that we're talking about in ecosystem in Unipol? Unipol has developed in the last 10 years this beyond insurance strategy that you might have heard of in Barcelona from Giacomo Lovati regarding the motor industry. And the basic idea behind is to complement the insurance services with pure services that are complementary with the needs of our customers. There are 3 intuitions behind this strategy. The first one is that we are spending several hundred of millions in claims every year. So basically, we are routing these margin that are through the services needed to solve claims to external partners. And if we can internalize this process, we could internalize as well the margin that is connected with the services. The second intuition was that the insured customers normally are silent for several years, but when they have a claims, they really evaluate the insurance for what the insurance is. So that's a very critical point in their customer journey, and they're very sensible in that moment. So they really take all the consideration of you as an insurer, depending on how you manage their claims. Being able to manage as a group that process, so offering directly our services, allow us to give an experience that is the best that we can offer. So we are not exposed to the uncertainty and the risk of relying on an outside partner that might or might not attend the standard that we aim to. And we are able to ensure that the customer is correctly served and can get out happily out of this moment of stress, which is the claim that normally happens in the insured customer life. The third point, the third intuition that made us come to this strategy was the fact that in order to offer top quality services to our insured customers, you cannot design those services only for the captive clients, because you will inevitably end up offering suboptimal services if you're not competing with the market. So if we wanted to do a strategy of internalization of the services needed for our customer, we had to go on the market, compete on the market, and aim to be the best on the market. And this was mostly to ensure that our customers will get the best experience possible on the market. And so they will not get a sub-experience that was cheap for us to offer. The goal was to get them to have the best customer experience possible, and at the same time, competing in the market, trying to extract some of the value that might be available on the market, which is the case for the welfare ecosystem, capturing that challenge opportunity I was mentioning before. So this strategy, the Beyond Insurance strategy, has been structured in 4 ecosystems. 3 are directly linked to the insurance business, the mobility, property, and welfare. The 4th ecosystem, the tech and payments, is basically functional to the other ecosystems. So the mobility was the first one to start, has been kicked off almost 10 years ago, and now is very relevant. It has a turnover of around 1.2 billion, and is covering a wide range of services that has been discussed in Barcelona last year, from long-term rental to car repair, roadside assistance, e-tolling, etc. Then you have the smallest ecosystem, which is the property. Is still very small, but is focused on managing facilities and repairing the claims from house insurance. So it's still developing, it's the smallest one, but we are seeing a lot of opportunity also there. The third ecosystem is linked to the insurance, is the one that I'm going to talk to you today, is the welfare ecosystem that has been basically developed in the last 3 years. I joined Unipol in 2021, specifically with the goal to develop the welfare ecosystem. When I joined Unipol, there were some initiatives that were being started, were being piloted to test this approach. And we were at that time seeing revenues from the few clinics that we have started and that were owned by the group of around 40 million per year. In the last 3 years, we have been growing this ecosystem to the current revenue level of 200 million, and we are still in a process of implementing the action and the plans for the ecosystem. We started with 3 pillars. They are the ones that are described in these slides. And this was basically the idea, the concept that we have developed in 2021. So the first 3 blocks that we wanted to lay down in order to then develop a full range of services within the welfare sector, within the healthcare sector, were the outpatient clinics, which are strongly linked to the idea of solving the issue of our health insured customers directly through a patient journey within our clinics for all outpatient needs, ensuring the best customer journey, and at the same time, as said, trying to re-internalize the marginality that there's connected with the services in the outpatient sector. The second block was the corporate welfare, and this was more an approach to enter in a stronger relationship with enterprises. Thanks to the large network, distribution network that I mentioned earlier, we are able to serve hundreds of thousands of small, medium, and large enterprises in Italy. And sometimes it's not so easy to engage them in a conversation on health insurance. It's not always super sexy, especially for small companies to talk about health insurance. Corporate welfare is a good angle to pitch a broader range of services, including the health insurance. And this allows us to walk through the path of welfare. Many companies that have never even approached the idea of employees' welfare, and then allow them to grow toward the path of offering services to their employee and benefiting from also the fiscal laws that allow to detract the cost for the welfare of the employees. The last pillar is the digital health, where we have seen it as two reasons why we need to develop that. The first one is that we can serve our insured customers and the market with innovative services that are becoming more and more available in the recent past, and thus offering services that are up to date and are very compelling, more convenient, and even more efficient in most of the times. The second reason is that the digital health will help us through the company Da Vinci that we have acquired in 2022 to basically be the pivot, connecting all the different pillars that we have already laid on the ground and that we will be laying on the ground in the coming years. So these are the 3 pillars that we have already set up, and I'm just going to briefly discuss with you about how we went through each of those. The outpatient clinics is a network currently counting on 45 clinics. We have started with the Adea, that was a brand developed by Unipol, and in 2021 has had 3 clinics. We are now at 45 due to the growth, the organic growth, so new openings, as well with the acquisition of Sant'Agostino, which was a leading network in the northern part of Italy. And now we are able to cover very well Milan and the Lombardy area. We have a good presence in the center of Italy, and we are starting our development in the city of Rome. The goal here is to serve the full territory in Italy, mostly focusing on where we have our insured client. The idea is to offer them clinics that are top edge and that can offer a patient journey very well integrated with their insurance, without all the problems that you might have in order to get reimbursement and things like that. So with a good pre-authorization and good processing through the patient journey. We are as well targeting, as said at the beginning, the outpatient market, the open market, given that the out-of-pocket is becoming more and more relevant in Italy. So we are capturing that opportunity I was mentioning earlier in terms of supporting the national health system with the outpatient needs of the patient that normally are not able to access through the public hospital in reasonable time to their needs. So this has become an important pillar in our strategy. They're still under development. We still have a long way to go. Our ambition is in the next 3 years to reach over 100 clinics around Italy, and to keep developing. First, where we will be focusing on the northern part of Italy, and then we will keep expanding to the south, where we still have a smaller base of insured customer, but is also a field rich of opportunities because of the strong needs in terms of patient needs due to the poorer level of health offering in the southern part of Italy. The second pillar that I mentioned earlier is in digital health. We acquired in 2022 a company called Da Vinci. It was a startup. It still is a startup that is trying to run as fast as possible with the support of Unipol. What we liked in Da Vinci was their approach in how to serve fully the patients. So Da Vinci started its business as a general practitioner software, with the idea that by serving the general practitioner with an effective and efficient software to interact with their patient, you're able also to engage the patient. And that idea convinced us in terms of being able to fully cover the patient journey of our insured customers and on-the-market customers. And we are developing with them 3 different projects. One is the one that I was mentioning with the general practitioner. So offering a software that allows the general practitioner to be more efficient, that allows an interaction with the patient. And this is especially a strong need now in Italy, because the general practitioners are fewer and fewer. In the next few years, we are going to have, in 2028, we are going to have around half of the general practitioners that are available in Italy compared to 2021. So there's a strong decline in numbers here. And this is due to the average age of general practitioner that is retiring in this year. Most of them are retiring. And there are not many young, new general practitioners joining the crew. So this challenge puts the general practitioner in a spot where he needs to be more efficient in order to keep doing his job. And with our software, we aim to help them doing this by reducing all the administrative work and all the interaction that are non-value added with their patient. By doing this, we are also entering the patient telephones, the patient smartphones, and we are allowing them to access several other opportunities in terms of health services. So not only interacting with their general practitioners, but also having the chance to access to outpatient clinic, inpatient clinic, diagnostic, virtual services, etc., which is the other line of business of Da Vinci. So Da Vinci also have developed a booking system that allow the customer, the insured customer, and the patient in the open market to book their examination, their specialty visit, or whatever their health need is, to a wide network of clinics that we can bring in Da Vinci through Unisalute. Unisalute has a very large network, and we are bringing them into the Da Vinci booking, using both for the insured customers and the out-of-pocket customers. The last piece of business that Da Vinci is tackling is the virtual care. So offering all those services that can be offered from a distance, being that telemedicine, being that psych online, or dermatologist online, or every specialty that can be effectively delivered without the need of a physical visit. We are implementing those services also with outside partners, with vertical offering on physiotherapy or dermatology or things like that, in order to complement our offering for the insured customers and also for the out-of-pocket customers that can access through the app LT that they have on the smartphone to interacting with their general practitioners. The last pillars in our strategy is through corporate welfare, as I was mentioning before. And here we decided to acquire not a provider, so the owner of the platform, but we decided to acquire the aggregator, so the catalog that is behind most of the platform in Italy. Tanto Svago is a company that we have acquired in 2022, and that enabled us to launch the strategy in the corporate welfare. This is the market leader in providing services to over 60 welfare platform in Italy. And we decided to acquire them in order to be effective in offering compelling services to our customers. And thanks to the acquisition of Tanto Svago, we were able to launch Wellbe, which is our proprietary company that is offering a welfare platform, and is the company that is going actually to the customers, that is opening the doors that I was mentioning earlier in terms of opening a conversation on corporate welfare, 360 corporate welfare, and from then on, establishing that relationship, we are able to offer all the services that the group has, including the health insurance. So this approach has been proven very successfully. Wellbe is on the market only since a year and a half, and we already reached more than 1,000 active client with over 80 million of welfare credit being loaded on the platform. And all the strategy here was to target a great experience, digital experience for the employees, trying to, again, remove all the annoying tasks in order to benefit from the welfare services. In Italy, you have this regulation that allow you to detract fiscally a large number of services, but you have very annoying and complex way in order to access those type of benefits for the employer. And most of the time, current platform in the market point to consult the client on how to organize themselves in order to benefit from those tax deduction. We, on the other hand, developed a platform that is fully digital, together with Da Vinci as well, that allowed us basically to give a user-friendly, very simple tool that reduces dramatically the effort on the employer side. So this is a very compelling pitch with companies in general, in order to bring them closer to the welfare world in general, and then to bring them also to the insurance services. So this is where we got so far. Here is what we've done in the last 3 years. We still have a lot of road ahead of us, and we have strong ambition. We will complement new pillars with these 3 that I have just described in the next coming years. We're exploring now different initiatives that were originally in our master plan, ranging from senior silver age to inpatient clinic to other sectors that we want to tackle. So what we will be doing in the next few years is keep developing these 3 pillars, and then keep adding new pillars in order to provide a broad scope and a full service to our customers. Thank you, everyone.